Hello? Imagine you lie down in bed at night, close your eyes, and open them to the smell of fresh coffee. It's not just a ritual. Coffee helps you wake up. Caffeine stimulates the nervous system, improving reaction time and concentration about an hour after a cup. But here comes the question. How healthy is it really? It seems to give energy, but don't we hear too often about blood pressure, arrhythmias, the stomach, insomnia? Opinions are many. But what does science say? This is Dr. Helena. Today, we will look together into dozens of scientific studies and try to understand for ourselves for whom coffee is beneficial, for whom it is not, and most importantly, how to drink it without harm. We'll break everything down clearly and draw conclusions together. All scientifically, in simple words. Thanks to antioxidants and anti-inflammatory compounds, coffee can support the general state of the body. And let's start with a question that often interests us. Does coffee affect the gastrointestinal tract? The answer is not as straightforward as it seems. For example, in one large study involving more than 8,000 people, no connection was found between coffee consumption and the risk of gastric or duodenal ulcers. And in earlier studies, including Scandinavian ones from the 1980s, it was noted that people with ulcers actually drank coffee less often than healthy people. Researchers suggest that it is not coffee that causes ulcers, but that patients themselves reduce consumption because of unpleasant symptoms, such as heartburn or pain. So the causal link here is far from clear. But still, coffee can increase discomfort in people with pre-existing gastrointestinal problems. For example, in a 2008 survey of 400 people in Jordan, it was found that those who drank coffee and other caffeinated drinks more often complained of heartburn, pain, bloating, and burning sensations in the stomach. That is, coffee does not cause ulcers, but it may simply worsen unpleasant symptoms in sensitive people. So drink with confidence, but if you already have a problem, it may increase discomfort, though not necessarily cause ulcers themselves. That's a complex but honest answer. And now, to the more positive side, it turns out coffee can protect the digestive system, and quite effectively. In one study, it was found that regular coffee consumption is associated with a reduced risk of non-alcoholic fatty liver disease, as well as with a lower likelihood of developing liver fibrosis in those who already have it. Whether coffee consumption can be considered a preventive measure requires further research. A study showed that 2 cups of coffee a day reduced the risk of gallstones by 11%. A nice bonus, right? The results of this meta-analysis state that in people who consume 2 cups of coffee a day, the risk of liver cancer was 43% lower. That's an impressive number, don't you agree? Not everything is unambiguous. In one old study, scientists noted a possible link between coffee and pancreatic cancer risk. But the data were obtained many years ago, the methodology is debatable, and later studies did not confirm this conclusion. So, with caution. In Japan, it was found that coffee and caffeine consumption was also associated with a reduced risk of ulcerative colitis. You might be surprised by what researchers from the Netherlands discovered. They noticed that in people, coffee also reduces the risk of colon cancer recurrence. As you can see, coffee has many beneficial properties, but it doesn't always work in our favor. Results show that herbal teas, as well as black tea, coffee, and cocoa, can be strong inhibitors of iron absorption, reducing its absorption by 40–90%. That is quite a lot, especially for people prone to deficiency or at risk of anemia. Why? It's simple. Polyphenols and tannins in these drinks bind iron and prevent its absorption in the intestine. That means iron becomes unavailable for the body. In a number of studies, including one from Korea in 2018, it was indicated that those who drank more than 3 cups of coffee a day had lower ferritin levels, the main marker of iron stores, in men, by 8%, in women by 19%. Moreover, other studies also found an inverse relationship between coffee consumption and ferritin levels in the blood. The more coffee, the lower the iron stores. Interestingly, green tea, unlike coffee and black tea, did not show this effect on ferritin levels. Therefore, if you have anemia, low hemoglobin, or problems with iron absorption, it's better to drink coffee not during meals, but an hour to an hour and a half after. This simple rule can really help avoid deficiency. And coffee will still be there. Brain and mood, and now to the brain. After all, for many of us, coffee is not just a habit, but a way to switch on, focus, and feel more energetic. And it works. Caffeine stimulates the central nervous system, helps with focus, reduces fatigue, and improves reaction. But there are also more long-term benefits. Studies show that in people who regularly drink coffee, the risk of developing neurodegenerative diseases such as Alzheimer's disease and Parkinson's disease is lower. And also less risk of depression. And this is not just coffee lifts mood. It's related to neurochemistry. Caffeine influences dopamine and other neurotransmitters responsible for wakefulness and pleasure. But of course, everything is good in moderation. If you overdo it, especially in people with sensitive nervous systems, coffee can cause irritability, anxiety, insomnia, or even tremors. So listen to your body. If you feel nervous after the second cup, that means it's enough for today. And finally, a special case pregnancy. Even 1 cup of coffee a day can be associated with a 3% increase in the risk of stillbirth. And speaking about caffeine in general, 100 milligrams per day, often even less than 1 large mug, is associated with an increase in this risk by 14 to 26%. And a 2021 meta-analysis showed, with the consumption of 2 or more cups of coffee a day, the risk of bleeding and preterm birth increases. So during pregnancy, coffee is better either seriously limited or completely replaced with decaffeinated alternatives. Heart and vessels, and now to the heart. Many are concerned, isn't coffee harmful for blood pressure and blood vessels? In reality, it's not so clear-cut. Coffee contains chlorogenic acid, a powerful natural antioxidant. It can lower blood pressure, improve circulation, and reduce vascular inflammation. Sounds like support, right? But everything depends on which coffee you drink and how your body is accustomed to it. In one study, it was noted, the caffeine and other active compounds vary greatly depending on the type, roast, and preparation method. This may explain why results differ across studies. For example, if a person is not used to drinking coffee, especially in large doses, blood pressure may temporarily rise. But if coffee is consumed regularly and moderately, 3 to 5 cups a day, then in most studies it either does not affect blood pressure or even has a beneficial effect. In one large analysis, scientists concluded, yes, coffee may temporarily raise blood pressure, especially in people not accustomed to it, but it does not cause hypertension and does not increase the long-term risk of developing it. And what about arrhythmias? There seem to be especially many fears. I have irregular heartbeat, so coffee is forbidden. But let's see what science says. In a large cohort study in 2021, where nearly 400,000 people were followed for 4.5 years, it was found each cup of coffee per day reduced the risk of arrhythmias by 3%. And this concerned not only general frequency, but also specific forms such as atrial fibrillation, supraventricular tachycardias, etc. And this is not the only study. In numerous systematic reviews and meta-analyses, no link was found between coffee and increased risk of atrial fibrillation. And in some cases, moderate doses of caffeine even reduced the risk by 13%. And there are many more studies confirming this fact. And what about ventricular extrasystoles? In studies, no connection with caffeine was found either. But an important nuance. In one separate 2021 study, scientists noticed that if you drink more than 1 cup of coffee at once, especially abruptly, without habit, the risk of extrasystoles can increase. Therefore, caffeine reduces the risk of arrhythmias, especially if consumed regularly, 2 to 3 cups a day. But if you drink rarely or suddenly in large amounts, say more than 10 cups, skipped beats may intensify. So as always, it's about balance. I want to note that everything I'm talking about is not my personal opinion, but an overview of data from scientific research published in international medical journals. I just collect and translate it into understandable language for you. When is the best time to drink coffee? and why is it important for health? It turns out the time of day when you drink coffee can significantly affect your body. And today I will tell you what new research says, and why morning coffee may be your best ally in health. At the end of February 2025, new scientific data was published that clarified a lot. Experts analyzed dietary habits of about 40,000 adults and linked them to health outcomes. It turns out morning coffee, between 4 a.m. and noon, can reduce the risk of premature death from cardiovascular diseases by as much as 31%. And even overall mortality risk, 10% lower in those who drink coffee before noon. Important, this effect is not observed in those who drink coffee in the afternoon or evening. So the main conclusion, drink coffee before lunch. Why is this so important? Two key mechanisms are at work here. First, caffeine disrupts circadian rhythms if consumed in the second half of the day, reducing melatonin production, the key sleep hormone. There is another interesting reason why coffee should be consumed in the morning. Namely, many of the health benefits of coffee are achieved because its active ingredients have strong anti-inflammatory effects. And what is important in this context is that the level of pro-inflammatory compounds in the blood depends on the time of day. The highest pro-inflammatory compounds circulate in the morning, so coffee helps reduce them thanks to its anti-inflammatory properties. That means morning coffee is not just energy, it is also prevention of inflammation in the body. Coffee is not just an aromatic drink, it is real science in a cup. It can both help and harm. And like any active substance, caffeine requires respect and balance. May your knowledge be beneficial and your health be reliable.